The Copenhagen Institute for Future Studies has released its 2025 COPD Index, showing global progress in disease management, while highlighting areas that still require urgent action. Jove Francisco has the report.
On World COPD Day, the Copenhagen Institute for Future Studies, through its Respiratory Health Initiative, released the 2025 Chronic Obstructive Pulmonary Disease Index. Data that show how the world is tackling the disease. Compared to the 2024 index, the new findings confirm stability in COPD care in many territories, but also highlights the fact that a lot more action needs to be done.
Let us make a shared commitment to turn words into action and awareness into oxygen for Malaysia, for Asia, and for the world.
Last week in Kuala Lumpur, Malaysia, Jose Luis Castro, the World Health Organization's special envoy for chronic respiratory diseases, told journalists that COPD remains one of the most underestimated global health threats. COPD kills over 3 million people each year and affects almost 400 million.
You can talk about deaths, you can talk about numbers, but it's also costing the economy, the global economy. It's a huge drain. So when you talk about the economic picture of COPD, 2 trillion USD is the cost of NCDs to the global economy, 2 trillion. And it's estimated that COPD accounts for nearly 150 billion of that. So it's a huge drain.
COPD is a lung disease that causes restricted airflow and breathing problems. Though manageable, COPD is incurable, hence the need for early detection. It affects lung function progressively in an irreversible manner, causing symptoms such as chronic cough, phlegm, difficulty in breathing, wheezing, and tiredness. Experts say COPD often receives clinical attention only when it becomes life-threatening in patients, especially those with multiple non-communicable diseases. COPD is a concern in Southeast Asia, where smoking is rampant and air pollution is among the world's worst. In the Philippines, it remains among the top 10 leading causes of death among Filipinos, with majority of cases due to smoking. Misdiagnosis also often happen in the Philippines because there is a lack of awareness about COPD. Neighboring countries can learn a lot from Malaysia and how it is working to improve COPD care. From aggressive info campaigns, reforms in health insurance coverage, and even state-of-the-art testing that includes artificial intelligence, like what was offered in this lung event organized just outside Kuala Lumpur.
Moving forward, actually, Malaysia is committed to continue to strengthen these lung initiatives. Of course, we want to improve the equitable access to care, especially the low-income population. So that's our main focus. Advancing global collaborative research, working together with WHO, and we also champion the ASEAN.
Proving that a shift towards proactive strategies is essential in dealing with COPD. Reporting from Kuala Lumpur, Malaysia, Jove Francisco, we are One News.